It's one of the most common health issues after 60, but almost no one wants to talk about it. Incontinence affects millions of seniors, yet the silence around it causes more harm than the condition itself. In this video, we break the stigma and share the honest truth about incontinence, what causes it, how to manage it, and why you're not alone. I never thought I'd need to plan outings around bathrooms. But after 60, some things just change. For many, this is the quiet part of aging, the part we whisper about if we talk about it at all, the part we avoid mentioning even to our closest friends, because the shame runs so much deeper than the inconvenience. Incontinence affects millions of seniors. It's not rare. It's not a personal failure. It's not something to feel embarrassed about, but most people still do. And that silence can be more harmful than the condition itself. It makes you isolate. You cancel plans, avoid long trips, even stop doing the things that once brought joy, just to avoid the worry of an accident. And slowly, life gets smaller. Not because your body gave out, but because no one ever told you the truth. You are not alone. This video isn't about shame. It's about understanding. It's about reclaiming your dignity by getting real about what's happening and how to manage it with confidence, clarity, and self-respect. We'll walk through the causes, because understanding why it happens is the first step to taking back control. We'll talk about the emotional toll, the anxiety, the silence, the impact on relationships, and most importantly, we'll talk about solutions, the treatments, tools, and simple changes that can make a world of difference. Because this part of aging doesn't need to be hidden, it needs to be heard. If you've been dealing with incontinence quietly, carrying it alone, this is your reminder. There is help, there are options, and there is absolutely nothing shameful about wanting to live freely, comfortably, and fully at any age. Let's break the silence together. Incontinence isn't just peeing a little when you laugh. It's not something to roll your eyes at or dismiss with a joke. And it's not something you have to simply live with because you've gotten older. But for too long, that's exactly how it's been treated, like a quiet inconvenience we're supposed to ignore. The truth is, incontinence is a real medical condition, and it deserves real attention, not silence or shame. It can show up in different ways. Maybe you feel a sudden, intense need to go and can't make it in time. Maybe it happens when you sneeze, laugh, or lift something heavy. Or maybe it's just frequent trips to the bathroom, enough to disrupt your sleep, your confidence, your day-to-day life. There are two main types, though they often overlap. One is stress incontinence, leakage caused by pressure or movement, a cough, a laugh, a step off the curb. It's your pelvic floor muscles struggling to hold steady when your body shifts. The other is urge incontinence, when your bladder sends an urgent signal out of nowhere and your body doesn't give you much time to respond. It's like your bladder has stopped listening to reason. And here's the most important thing. It's not your fault. Incontinence isn't a character flaw. It's not a sign of laziness or weakness. It's not something you let happen. It can be caused by muscle changes, hormone shifts, nerve signals, medication side effects, prostate issues in men, childbirth history in women, or even chronic conditions like diabetes or Parkinson's. It's not always about aging, it's about awareness. And what many people don't realize is that incontinence, while common, is often treatable. Not always curable, but manageable in ways that can restore your comfort, your confidence, and your quality of life. You don't have to accept it as your new normal. You don't have to stop doing things you enjoy. You don't have to hide extra clothes in your bag or scout out every public restroom like it's survival. You don't have to live small because of something that can often be helped. The hardest part sometimes is just saying the word out loud. But once you do, everything can begin to change. Because once you name it, you can start learning how to manage it. So if you've been experiencing urgency, leaking, or changes in your bladder that feel out of your control, you're not alone, and you're not broken. This isn't about embarrassment. It's about information. It's about dignity, and it's about realizing that what you're going through isn't rare, it isn't hopeless, and it absolutely isn't something to feel ashamed of. It's something to talk about, because only then can you start to take back control one day and one decision at a time. When you're dealing with incontinence after 60, the first question that quietly echoes is, why is this happening to me? It's a question asked more in frustration than fear, and one that deserves more than a vague shrug or a generic answer like it's just part of aging. Because while incontinence may be common, it's not random, it's not your fault, and understanding the reasons behind it can be the first step toward managing it with confidence and clarity. One of the most common causes is something rarely talked about until it becomes a problem: weakened pelvic floor muscles. These muscles support the bladder and control the flow of urine, but over time, and especially after events like childbirth, menopause, or abdominal surgeries, they can lose strength. When that happens, even simple movements like coughing, laughing, or standing up can trigger leakage. It's not about control, it's about muscle function. And like any muscle, these can often be retrained or strengthened. For men, incontinence is frequently tied to prostate issues. An enlarged prostate can press against the bladder or interfere with urine flow, leading to urgency, difficulty starting or stopping, or incomplete emptying. Even after prostate surgery, especially for conditions like cancer, some men experience temporary or long-term changes in bladder control. Again, it's not weakness, it's anatomy, and it's manageable. Certain chronic conditions can also play a major role, especially those that affect the nervous system: diabetes, Parkinson's disease, multiple sclerosis. These and other neurological disorders can interfere with the brain to bladder signals, making it harder to sense fullness or control timing. The result can be sudden urges, leaks, or even accidents that seem to happen out of nowhere. And then there are the medications. Diuretics, often prescribed for blood pressure or heart conditions, increase urine production, sometimes too much, too fast. Other medications may relax bladder muscles too much or interfere with nerve signals. What's meant to help one issue may unintentionally cause another. That's why it's so important to review all your medications regularly, especially if bladder changes appear soon after a new prescription. The truth is, incontinence rarely has one single cause. Often, it's a combination of factors. Muscle changes, medications, hormones, chronic conditions, even diet and hydration. But understanding what's behind it can transform the way you respond to it. It means you stop blaming yourself. You stop assuming it's just aging, and you start getting curious, proactive, empowered. You start asking the right questions, talking to your doctor with confidence, exploring exercises, therapies, or treatments that are designed for exactly what you're experiencing. Because when you know the why, the what now becomes a lot more hopeful. You are not weak for facing this, you are strong for wanting to understand it. And the more you understand what's happening in your body, the more you can start reclaiming the comfort, confidence, and freedom that every person at every age deserves. For something so common, incontinence carries a silence that's hard to explain. It's not just physical, it's emotional. And for many seniors, it becomes the secret they carry alone, even as it quietly reshapes their life. They stop going out for long periods. They turn down invitations. They plan every outing around a restroom. They pack extra clothes just in case, but pray they won't need them. And even though it slowly steals moments, confidence, and comfort, they still don't talk about it. Not to family, not to friends, often not even to their doctor. Why? Because embarrassment is a heavy thing, and shame whispers cruel lies. Like this is your fault, you're losing control, or you're not who you used to be. It tells you to stay quiet, to hide, to pretend nothing's wrong because admitting it feels too vulnerable. Then there's the fear that if you speak up, someone will want to take something away, your car keys, your independence, your ability to live alone. The fear that this one conversation might change everything. So instead, you manage it quietly. You hope it goes away. You tell yourself it's just part of getting older. But here's the truth. Silence helps no one. And incontinence isn't a shameful secret. It's a medical condition, one that's more common than people realize and more manageable than most are ever told. Many seniors don't mention it to their doctor until it starts affecting everything: sleep, mood, social life, even their sense of identity. But by then, the impact has grown so much larger than the physical symptoms. It becomes about dignity, isolation, fear. You deserve better than that. This isn't about weakness. It's about worth, about knowing that your quality of life matters and that even the hard conversations can open doors to comfort, healing, and relief. Doctors can't help with what they don't know, and incontinence isn't something you have to just live with, but they need to hear it. Not just when it's unbearable, but when it begins, when it first starts to shift the way you move through your day, because the earlier you speak up, the more options you have. You are not alone in this, and you're certainly not broken. You are human, brave, deserving of care that sees your whole story, not just what you're willing to say out loud. There's power in speaking the truth of your experience, in naming what hurts, in saying, "I need help," not because you're helpless, but because you matter. And if no one has told you yet, this isn't your fault. You didn't fail. And the minute you stop staying silent is the moment things begin to change. Because your voice, it still carries weight, and your life, your dignity, is worth every word. When you've been living with incontinence, it's easy to feel like your body is working against you, that no matter how careful you are, accidents still happen, that control, comfort, and confidence are things you used to have, but not anymore. But here's the truth. There are ways to take back control. Real, practical steps that can make a real difference, physically and emotionally. One of the most effective places to begin is where many people least expect it: pelvic floor therapy. Whether you're a man or a woman, your pelvic floor muscles play a crucial role in controlling the bladder. And just like any other muscle, they can weaken over time, but they can also be retrained. Kegel exercises are a simple but powerful tool. Done consistently, they strengthen those deep muscles that support your bladder and help reduce leakage. It's not a quick fix, and it takes practice, but the progress is real. Many people see improvement within weeks, and it can restore something even more valuable than physical control: your sense of confidence. Another approach is bladder training. That means setting a schedule for bathroom visits, even before the urge hits. At first, it may feel strange to go before you have to, but over time it helps train the bladder to hold more and reduces the frequency of sudden, urgent trips. It's a small shift in habit, but it creates a ripple effect in comfort and control. Diet also plays a role, often in ways we overlook. Certain foods and drinks can irritate the bladder. Caffeine, alcohol, citrus fruits, artificial sweeteners, all of these can increase urgency and frequency. It doesn't mean you have to give up everything you enjoy, but noticing your triggers and making small adjustments can ease your symptoms more than you might expect. And when support is needed, when the leaks still happen, know that you have options that weren't available a generation ago. Today's incontinence products are discreet, comfortable, and thoughtfully designed. Pads, liners, and absorbent underwear are no longer bulky or embarrassing. They're tools for living freely, with dignity and peace of mind. It's okay to use them, it's okay to need them, because managing incontinence isn't about hiding, it's about giving yourself permission to live fully again. There is no shame in seeking comfort, in choosing products or practices that help you feel prepared, in taking steps, one at a time, to improve your symptoms and reclaim your independence. This journey isn't just about bladder control. It's about self-respect, about tuning into your body with compassion, about knowing that you deserve not just answers, but relief. You don't have to accept discomfort as your new normal. There are paths forward. You are allowed to try, to hope, to heal. And it all begins with the belief that better is possible, because it is, and because you deserve it. There comes a point when managing things quietly stops working, when the midnight bathroom runs start robbing you of sleep, when the fear of an accident makes you cancel a lunch date or skip a family event, when your world slowly shrinks around what your bladder might do next. That's when it's time to talk to a doctor. Not because you've failed, not because you didn't try hard enough, but because you deserve help. Because this isn't about willpower. It's about wellness. Incontinence is a medical condition, and like any condition, it deserves care, not silence. If you're experiencing frequent leakage, if you're waking up multiple times a night just to rush to the bathroom, if you find yourself avoiding activities you used to enjoy, it's time to speak up. Those aren't minor inconveniences. They're signs that your body is asking for support, and there's no shame in answering that call. Many people don't realize that there are specialists who focus specifically on this. Urologists, urogynecologists, and geriatricians are trained to treat incontinence with compassion and skill. They understand how common it is, how personal it feels, and how treatable it can be. When you do reach out, the first step will be a conversation about your symptoms, your lifestyle, your medical history. They may ask you to keep a bladder diary for a few days. They might run a few non-invasive tests, but more importantly, they'll listen, and they'll help you understand that this isn't just something you have to live with. Treatment options vary depending on your body and your specific needs. It might be medication to calm an overactive bladder. It might be pelvic floor therapy guided by a professional. In some cases, newer technologies or minimally invasive procedures may be recommended. But no matter the path, the goal is the same: to give you back your comfort and control. And if the incontinence is tied to another condition, like diabetes, prostate issues, or neurological disorders, they can help you manage the root cause, not just the symptom. What matters most is remembering that this is medical, not moral. You are not weak for needing help. You are wise for asking. Too many seniors wait until the impact on their life becomes unbearable. But you don't have to wait that long. You can speak up now, while your quality of life still has space to grow, not just shrink. The strongest thing you can do is take that first step, even if your voice shakes a little. Because there is no weakness in wanting to feel better. There is only strength in choosing not to suffer alone. Your dignity is worth the appointment. Your freedom is worth the conversation. And your life, your full, vibrant life, is worth every bit of the support that's already waiting for you. You just have to ask. And that single step could change everything. What no one talks about enough is the part of incontinence that doesn't show up on a test result or in a symptom tracker. It's not just about the bladder. It's about how it quietly seeps into your sense of self, how it changes the way you move through the world, the way you view your own body, the way you relate to others. For many, it starts small. You turn down an invitation because you're not sure there will be a restroom nearby. You stop going on long walks or taking road trips. You sit near exits, you excuse yourself more often, you stop wearing light-colored clothes. Then one day you realize you're not doing the things you used to love. Not because you're physically unable, but because you're emotionally guarded. That's the real toll of incontinence. Not just the inconvenience, not even the discomfort, but the slow erosion of confidence. The way it makes you feel embarrassed in moments that once felt effortless. The way it pushes you into isolation, not because you want to be alone, but because you're trying to avoid being noticed. But here's something you need to hear. You are not alone in this. And more importantly, you don't have to stay in that place of silence. The first step toward reclaiming your confidence isn't a product or a treatment. It's a conversation. Talk to one trusted person. Someone who will listen without judgment. Maybe it's a friend, a spouse, a doctor, or even someone you meet in an online forum. Just saying the words out loud, "This is happening to me," can lift the weight you've been carrying alone. There are support groups, both in person and online, filled with people who understand, who felt the same worry, the same embarrassment, and who have learned how to manage it, not just physically, but emotionally. In those spaces, people trade tips, but they also trade hope. They remind each other that life doesn't stop with incontinence, that joy, movement, laughter, and connection are still possible. and still worth pursuing. When you start talking about it, when you hear someone else say, "Me too," the fear loses its grip, the shame starts to dissolve, and in its place grows something powerful: resilience. You begin to realize that dignity isn't about hiding the problem. It's about facing it with courage. That strength doesn't mean pretending nothing's wrong. It means showing up anyway, even if you're uncertain. You are still whole. You are still worthy of being seen. And the moments you've been missing, those lunches, that walk in the park, that quiet dinner with friends, they're still waiting for you. You just have to give yourself permission to believe that healing isn't only about your body, it's also about your heart. And with each small, honest step, you're not just managing a condition, you're reclaiming your freedom. One moment at a time. Your body may change, but your dignity never has to. Incontinence is one part of your story, not the whole thing. It doesn't define who you are, what you've overcome, or what kind of life you're still meant to live. And talking about it, acknowledging it out loud, that isn't weakness. It's wisdom. It's courage. It's the moment where healing begins. For too long, this conversation has been pushed into the shadows, wrapped in silence, shame, and unnecessary suffering. But you deserve better. You deserve to feel seen, heard, supported. You deserve care that respects not just your body, but your spirit. Maybe you've been quietly managing symptoms, changing your routines, shrinking your life around what your bladder might do. Maybe you've blamed yourself, thinking you're the only one dealing with this. But you're not. Millions of people walk this same path, and many are just waiting for someone to say it first, to break the silence so they can breathe a little easier too. If you've been suffering in silence, it's time to speak. To your doctor, to someone you trust, to yourself. Not because everything will be fixed in a day, but because the moment you ask for help is the moment you start taking your life back. Incontinence isn't a failure. It's a medical condition, and like anything else, it can be understood, managed, and cared for. With the right information, the right support, and the right mindset, freedom becomes possible again. You are still you, whole, worthy, and capable of joy, and there is so much life still waiting to be lived. So be gentle with yourself, be honest, and be brave enough to believe that healing isn't just possible, it's something you deserve. Thank you for being here. You're not alone, and you never were. Thank you for watching and for having the courage to listen to a conversation that so many avoid. If this video made you feel seen or reminded you that you're not alone, I hope you'll share it with someone who might need that same reassurance. You never know who's quietly struggling and how much comfort a single video can bring. At Elderly Truths, we believe in dignity, honesty, and the power of real conversation. So if you found value here, please like, subscribe, and join us for more reflections that speak to the heart of growing older, with strength, with grace, and with hope. Until next time, take care of yourself, and remember, your voice matters, and so do you.